Hello and welcome once more to The Bottom Line, brought to you by Telecom TV and sponsored by IBN. Of all the adjacent markets that abut ICT, e-healthcare is one that holds immense potential.
Telemedicine is basically using telecommunications networks to enable quite a range of things, including at the extreme end, actually operating remotely from the patient. But in principle, it's more about the cooperation of doctors, enabling what is essentially a scarce resource to work with one another in a much more effective way.
The model of healthcare delivery is changing because costs have kept going up. There's no way that you can sustain putting more and more people into hospital and giving them more and more sophisticated treatments without some support from technology.
Provided carriers can demonstrate that their systems are secure, strong and flexible, now is the time for those operators and service providers to establish their place in the pecking order as specific health-related applications come to mobile devices.
Operators will be a fundamental part of the whole ecosystem just because they understand services. In particular for mobile health, they will have to collaborate with the healthcare industry and with its providers and infrastructure vendors as well if they want to provide a service that is scalable and viable.
The e-health and telemedicine sector relies on the movement of massive amounts of data to get the information to where it's needed, when it's needed.
The potential is phenomenal because so much of what we do is information-based.
The information that used to be siloed in individual organisations now has to be shared between the organisations, and the only way we can do that is to put a high-capacity network. And I think that's a model which is taking hold everywhere. I think everyone is facing the same cost challenges, and there's a real drive to use telecoms to deliver some cost efficiencies.
We've been talking about digitising all our healthcare records, so that's the actual paper folders. That's a very significant investment, but it doesn't take a lot of analysis to show that, say, in 5 years' time, the payback is phenomenal, both purely in financial terms and also in patient care terms.
Service providers and operators looking to extend the scope of their activities into realms outside ordinary telecom services are in pole position to take advantage of their proximity to and involvement in the adjacent disciplines of e-health and telemedicine. The doctor is in. Now is the time for operators to make an appointment to go and see him.